Greetings to you. Hopefully everyone is doing well. And I take this opportunity to welcome you to our health topical discussion every Friday night at exactly cut. Yes, greetings to you. And hopefully everyone is doing well. My name is Samuel Robert Masaka, and I'm the Director of Home-Based Medical Services Television, the one of its kind, and we say HBMS TV, Talking Health. And I want to welcome you to our topical discussion. That is the health discussion that we always have every Friday, late in the night. But it is always important that you spare off these few minutes and learn something about your health. And today I'm going to be discussing something that is very, very vital, and that is diabetes mellitus, or call it DM. If you're out there and you have a friend, you have someone who has diabetes, this is something that they need to understand, the basic knowledge that you need to have about diabetes, and then see how you can live a healthy life. This talk show happens every Friday with different topical discussions in the line of what we can offer as a contribution to the country. HBMS TV, Talking Health, Home-Based Medical Services Television, the first of its kind. This program is proudly sponsored by C24/7, the #1 nutraceutical food supplement on the world market. But more importantly, it is also sponsored by Bitiana Institute of Nursing and Midwifery. And today's discussion, the objectives of the discussion, we are going to be looking at the definition and introduction about diabetes. Then we will look at the signs and symptoms. Then we will also look at the risk factors of diabetes. Then types of diabetes, the common ones. Then the risk factors associated with mortality and morbidity in diabetic patients. We will also look at briefly about the investigations and diagnostic criteria. How do you know that you have diabetes? Then we will look at also the aims of management of diabetes. More importantly, we will also look at the non-pharmacological measures, and then the diabetic plate, and also the nutritional supplements and their role. So basically, as the director at HBMS TV, I just love to do this contribution towards the country, towards that one person out there who wants to live a healthier life. So when we go on, I want to discuss something very, very vital about when we look at the definition and introduction of diabetes. I want to bring it to your notice that diabetes mellitus is a chronic disorder, something that is there on that is chronic, takes longer. It's a chronic disorder of carbohydrates, talk about fats and proteins metabolism resulting from absolute or relative insulin deficiency or resistance. You all know we have the pancreatic beta cells that are supposed to produce insulin. At times, the body cells become resistant, or at times it is deficient, it is not enough. And it is characterized by hyperglycemia or increased concentration of glucose in blood. In case this is prolonged, it results in two different complications, things like retinopathy, issues to do with your sight and eyes, then nephropathy, that is to do with the kidneys and the nephrons, then also the neuropathy. So all that is the basic you can know about this. And when we talk about, that is about a definition, but let's talk about the signs and symptoms of DM. When you look at the signs and symptoms of DM, It should be for a long period of time, or it should be prolonged. Talk about excessive thirsty, all the time you feel thirsty. Then the other one is excessive tiredness, all the time you feel tired. Then increased appetite, that is for food. I remember there's a client of mine who was asking me about appetite. Me, I was dealing with appetite for food. At the end of the day, I was talking about something else. So here, I'm talking about appetite for food, increased appetite, then recurrent boils, the simple swellings or wounds that do not heal. They are also common. Then the genital itching, that is in both, but very common in ladies. Then the other one is excessive urine. Every time you have an excessive production of urine, and it's called polyuria. Then the other one is unexplained weight loss. Out of the blue, you lose weight. Then to men, there is also impotence. It is a sign. Then blood vision, upward sight. So these are signs and symptoms. However, we do not say that this is conclusive the moment you have them, you have diabetes. No, these are just signs. So the other one that I want to talk about is the other one that I want to discuss about is types of diabetes mellitus. The types of diabetes mellitus. We have type 1 diabetes mellitus, which is insulin-dependent diabetes. And it is as a result of insulin deficiency. And at this point, we've even gone extra mile to introduce the exogenous insulin to people for them to survive. Then we have the type 2 diabetes mellitus. This one is the non-insulin dependent diabetes, common in obesity, then older age, and it runs in families at times. And then the other one, we have what we call the gestation diabetes. When we look at the gestation diabetes, this develops during pregnancy in previously non-diabetic women. Temporary form of insulin resistance due to hormones. You know, as hormones increase, what times it is not being able to produce enough of it, not being in position for the pancreas to produce enough insulin. So that is diabetic. That is the gestation diabetes. Then the other one is the risk factors associated with mortality and morbidity in diabetic patients. We need to look at hypertension. Then the other one is the early age diabetes onset. And then the other one is hyperlipidemia. Then obesity. Then the other one is duration of diabetes. And the other one is the proteinuria, a lot of proteins in the urine. So more importantly, we want to look at the investigations. You need to look at the investigations and the diagnostic criteria. You need to know that at this we are looking at blood glucose or urine glucose, the levels there. We have the fasting plasma glucose or the fast blood sugar levels. And if anything comes consistent and it is over or greater than 7.0 millimoles per liter or 126 milligrams per deciliter, one can be diagnosed to have diabetes. Then the other one is the random plasma glucose or the random blood sugar levels. If it is greater than 11.1 millimoles per liter or 200 milligrams per deciliter, then one could be having diabetes. But you need to note it from me that one abnormal laboratory value is diagnostic in somebody who is symptomatic. He has all the signs and symptoms, and then 2 or more in asymptomatic patients. You need to note that very well. So as our objectives, the other thing is we need to look at the aims of management of diabetes or management of DM. Our focus is to relieve symptoms, maintain normal blood glucose levels, then prevent acute complications like acidosis and all that, then prevent chronic complications like limb amputation, talk about blindness. Then you can also talk about the kidney disease. Then the other one, we need to look at the non-pharmacological measures. Number one, health education about the disease itself. And that is what we are doing for you at Home-Based Medical Services Pearl Vision, to make sure that you keep in the know. Then the other one is you need to advise people to avoid refined sugars, especially soft drinks and beers. Then the other one is use more of plant origin carbohydrates and proteins. It is very healthy. Then keep doing self-glucose monitoring. That is, if you can, don't wait, because at times you're going to find this by chance that you're diabetic. Then commit to regular simple exercises. You don't need to work out a lot, simply because you may, in one or the other, you may die when you're working out. Glucose becomes less in the blood sugar, and then you can pass on. So I advise you to commit to regular simple exercises. And now, what is more important that you need to look at is the diabetic plate. When we talk about the diabetic plate, this is the health diabetes plate. You can do fruits. Milk and yogurt is also good. Then non-starchy vegetables, the broccoli, the tomatoes, all those things. Then starch will be gotten from the cereals. Then look at the lean proteins. All these are very vital for you to live a healthier life. But more importantly, you need to look at this management here with nutritional supplements. When we talk about nutritional supplements, I want to introduce to you that wonderful product that is C24/7. C24/7 simply means complete nutrition, 24 hours, 7 days a week. It has over 22,000 phytonutrients that you need for you to maintain your sugar levels in the body and prevent environmental complications. It has a sister product that is complete phyto energizer, very awesome. The only difference, the complete does not have the anti-aging. Then Restore Life, it even increases sensitivity to insulin, plus preventing all complications that come with age. And collagen is the cholesterol-reduced omega-3 fish oil, combined with vitamin E, plus DHA, which is food for the brain. Then you have that beautiful beef bread, which is the sugar-free living alkaline coffee, sugar-free, with a natural sweetener that is stevia, that is good for people who are diabetic. However, we have more coffees that have natural sweeteners, like the living alkaline coffee, the latte, the oregano, the cappuccino. All these are beautiful products that you need to live a healthier life, both to prevent or reverse. However, I want to bring it to your notice that if you have any chronic illness and you're taking any drugs, don't withdraw from your drugs. You just need to supplement, or you just need to add on these products, and we will guide you on the dosage and everything. So I want to thank you very much for following through. It has been really an awesome sharing this Friday. And anyone who is out there and you need to learn something about your health, don't forget to subscribe to our YouTube channel. That is Home-Based Medical Services Pearl Vision, Talking Health, or HBMS TV, Talking Health. Every Friday, we have different programs for you to help you learn something. All these programs are sponsored by C24/7, the #1 food supplement, Natural in Nature. And more importantly, the program is also sponsored by Mitiana Institute of Nursing and Midwifery. We are promoting health such that people can live a healthier life. In case you have any questions, you can always keep them coming, and may God bless you. Have a blessed weekend. Stay blessed.